Today I will explain the health benefits of drinking baking soda, also known as sodium bicarbonate, mixed with water. You can find numerous articles on this topic online, but it's important to note that some of the claims made lack scientific backing. That's why I've gathered the most up-to-date scientific knowledge for you. Based on research studies, I'll explain how drinking baking soda with water can benefit us. There are also many common questions surrounding this topic, such as, how much baking soda should you consume? What are the contraindications for its use? What side effects can it cause? Does it interact with medications? Can it relieve heartburn? Does it damage tooth enamel? Can it help treat acne? And many other interesting questions. Let's begin with oral health. According to scientific research, sodium bicarbonate has a very beneficial effect on oral health. This is supported by one of many meta-analyses, which are considered the highest quality of scientific studies. In this particular analysis, the effectiveness of toothpaste containing 20% and 35% baking soda was evaluated. The study demonstrated that individuals who regularly used these products experienced a significant reduction in dental plaque, inflammation, and gum bleeding. Interestingly, the results for fluoride-only toothpaste were not as effective as those for toothpaste with added baking soda. What's more, other studies have shown that dental cleaning products containing baking soda effectively remove plaque from hard-to-reach areas of the teeth, such as interdental spaces, those areas where teeth touch each other. This is particularly important because cavities often form in these spaces, where toothbrushes cannot reach, and only dental floss can clean. Let's be honest though, most of us don't use floss as often as we should. Additionally, baking soda exhibits significant antibacterial activity against oral pathogens, including Streptococcus mutans, one of the bacteria responsible for tooth decay. Another crucial benefit is that baking soda raises the pH of saliva. This process prevents the weakening of enamel and promotes its remineralization and repair. Based on this, it can be confidently stated that mouth rinses containing sodium bicarbonate can serve as a cost-effective and efficient alternative to specialized products. Continuing on this topic, it's worth mentioning the correlation between using baking soda and removing tooth stains. Scientific studies confirm not only its safety, but also its high effectiveness in this regard. It's safe to say that products containing baking soda deliver better whitening results than those without it. As a fun fact, many people might try this method specifically to whiten their teeth, and scientific research suggests that using an electric toothbrush can produce the most noticeable results. Since we briefly touched on the topic of pathogens, it's worth mentioning that baking soda also exhibits antifungal properties. One scientific study confirmed its ability to neutralize 3 groups of fungi: yeasts, dermatophytes, and molds, which are responsible for skin and nail infections in humans. In some cases, fungal growth was reduced, while in others, it was completely inhibited. When discussing the health-promoting properties of baking soda, it's also important to highlight its effects on alleviating psoriasis symptoms. This is well illustrated by a study conducted on 31 patients suffering from mild to moderate psoriasis. During the study, 12 participants received a placebo, an inactive substance, while the remaining 19 took therapeutic baths with sodium bicarbonate or baking soda. The results showed that nearly all participants who used the baths experienced significant relief from symptoms such as itching and skin irritation. The improvement was so noticeable that many of them decided to continue the treatment even after the study ended. Based on the findings of this analysis, it can be concluded that therapeutic baths with baking soda are a valuable complement to conventional psoriasis treatments. Moving on, it's worth noting that there is strong evidence suggesting that baking soda supplementation can help alleviate lower urinary tract symptoms. This is supported by a study conducted on 33 female patients suffering from this condition. Over a period of 4 weeks, they took oral sodium bicarbonate in 2 daily doses of 4 grams each. The study found that, after this time, the participants experienced an increase in urine pH and a reduction in urinary frequency. Additionally, issues such as urinary incontinence and urgency were significantly reduced. Since baking soda exhibits bacteriostatic properties and helps thin mucus, it may serve as a complementary therapy for cystic fibrosis. In one study, 12 patients under the age of 18 underwent inhalation therapy with baking soda using a nebulizer. This method resulted in a reduction in the viscosity and viscoelasticity of their sputum. However, it's important to note that these are only preliminary observations, and baking soda inhalation should not be implemented without medical supervision. Now let's move on to a point that will surely excite those who value physical activity. Scientific reports indicate that sodium bicarbonate, or baking soda, enhances physical performance across various sports disciplines. These include boxing, judo, jiu-jitsu, taekwondo, and, to a lesser extent, wrestling. After introducing baking soda supplementation, either on its own or in combination with other substances, such as beta-alanine, athletes experienced improvements in several areas. For example, in boxing, there was an increase in the overall accuracy of punches. In jiu-jitsu, upper body endurance improved, while in taekwondo, the duration of attack sequences was extended. Since baking soda enhances physical performance in athletes performing repetitive and high-intensity movements, its benefits can also be applied to other sports disciplines. According to the scientific literature, its use has been shown to improve performance in high-intensity cycling, short-distance running, rowing, and swimming over a 200-meter distance. Now let's move on to some important facts about baking soda itself. Question 1. How much baking soda dissolved in water should you consume daily? According to general guidelines, the recommended dose is between 4 and 8 grams per day, dissolved in a glass of water. The minimum dose is just under 1 small teaspoon, which is considered the standard amount. However, as the intake increases, it should be accompanied by increased physical activity. Question 2. What are the contraindications for using baking soda? It's important to remember that a water solution of baking soda has an alkaline pH, meaning it is basic. Its consumption is not recommended for individuals diagnosed with metabolic or respiratory alkalosis, as it may exacerbate the symptoms of these conditions. Additionally, it is not advised for people with hypocalcemia, which is a condition characterized by low calcium levels in the blood, or hypernatremia, an excess of sodium in the body. Patients with congestive heart failure, kidney failure, sarcoidosis, dehydration, or electrolyte imbalances should exercise particular caution when consuming baking soda. Question 3. What side effects can be associated with consuming baking soda? First, it's important to emphasize that appropriate and short-term consumption of sodium bicarbonate usually does not cause any side effects. However, problems arise when it is consumed excessively or over a prolonged period, especially intravenously. The most common complications include metabolic alkalosis, muscle pain and tremors, headaches, nervousness, restlessness, increased urination, nausea, vomiting, abdominal pain, and reduced levels of potassium and calcium. In extreme cases, consuming very large amounts can lead to breathing difficulties, tissue swelling, blood clotting disorders, and even stomach wall rupture. Question 4. Does baking soda interact with medications, and what should it not be combined with? It's important to note that baking soda can interact with various medications, including antibiotics, primarily minocycline and doxycycline, nonsteroidal anti-inflammatory drugs such as sulfasalazine, mesalazine, and ketoconazole, as well as antacids. Question 5. Should baking soda be consumed on an empty stomach or a full stomach? Baking soda should not be consumed on a full stomach, as this may lead to stomach damage. A safer option is to take it on an empty stomach, provided there are no contraindications to doing so. Question 6. Does baking soda relieve heartburn? Contrary to popular belief, consuming baking soda is not the best remedy for heartburn. While it does neutralize stomach acid, its effects are short-lived and provide only temporary relief. A more reasonable solution is to use treatments for heartburn that are supported by scientific research. Question 7. Does baking soda damage tooth enamel? The safety of oral hygiene products containing baking soda has been thoroughly studied. According to numerous clinical and laboratory studies, toothpaste with baking soda is safe for enamel because it has low abrasiveness. Furthermore, as mentioned earlier, these products not only reduce dental plaque, but also exhibit antibacterial and anti-inflammatory properties. Question 8. Does baking soda help treat acne? Opinions on using baking soda for this purpose are highly divided. Of course, you can find various sources online claiming its beneficial effects on facial skin, along with numerous recipes for homemade masks using baking soda. However, there are also many critics of this method. It's important to keep in mind that baking soda alters the skin's pH, disrupting its natural barrier. This can lead to dryness, irritation, excessive peeling, and the proliferation of microorganisms. So far, there have been very few scientific studies on the safety of applying sodium bicarbonate directly to the skin. For this reason, I recommend opting for dermatologically tested cosmetics and performing any treatments under the supervision of a specialist. Question 9. Does baking soda lighten hair? Applying baking soda to hair is just as controversial as using it on the skin. According to many online sources, baking soda can lighten hair after coloring. However, please note that this phenomenon has not been confirmed by scientific studies. These claims are based solely on anecdotal reports from individuals who have tried this method. There are, however, studies indicating that prolonged use of baking soda on the scalp is not beneficial for hair health. It's important to know that the pH of the scalp is 5.5, while the pH of the hair shaft is 3.6. According to the scientific literature, baking soda, which has a much higher pH, increases hair brittleness and can lead to excessive frizz and damage to the hair cuticle. Question 10. Does baking soda treat diaper rash? Many popular parenting websites claim that washing a baby's skin with a mixture of water and baking soda effectively treats diaper rash. However, I would advise approaching this method with great caution. I came across a case report in which a 4-month-old infant developed metabolic alkalosis as a result of applying a large amount of baking soda to a diaper, not orally, but directly to the diaper. Fortunately, after discontinuing this practice, the symptoms in the child resolved. Question 11. How can you check if baking soda is still fresh? Few people realize that improperly stored baking soda can spoil over time. Fortunately, there's a simple at-home method to check its freshness. All you need to do is pour a small amount of baking soda into warm water and then add a few drops of vinegar or lemon juice. If the mixture bubbles vigorously, it means the baking soda is still good to use. Question 12. How should baking soda be stored? To keep baking soda fresh and effective for as long as possible, it should be stored in an airtight container or jar, preferably in a cool, dark place. It is generally recommended to use it within 6 months of opening the package. In one study, baking soda was used to neutralize the odor of decomposing waste. It was found that sprinkling 50 grams of baking soda at the bottom of an 8-liter trash bin reduced unpleasant odor by as much as 70%. Now, let's talk about some practical uses of baking soda around the house. Baking soda is excellent for neutralizing unpleasant odors. Why? Because unlike air fresheners, it doesn't mask odors but neutralizes them. Additionally, baking soda can help eliminate the smell of garlic or onion from your hands. Simply mix it with water, rub the paste onto your hands, and then rinse it off with water. It's also worth noting that baking soda can effectively replace a refrigerator deodorizer. All you need to do is pour a few tablespoons of baking soda into a small bowl and place it on one of the shelves. Remember, baking soda is also a key ingredient in natural deodorants. To make one, simply mix 50 grams of coconut oil, 15 drops of your favorite essential oil, and 3 tablespoons of baking soda. Transfer the resulting paste into a jar to extend its shelf life. It's best to store it in the refrigerator. However, please keep in mind that baking soda, like any other ingredient, can cause allergic reactions. Before using this deodorant, I encourage you to perform a patch test. This involves applying a small amount of the product to a clean and, most importantly, dry area of the forearm. To prevent it from getting wet, you can cover it with a waterproof bandage. If no redness, irritation, rash, or itching occurs after 24 hours, the product should be safe for you to use. Baking soda also helps remove pesticides from fruits and vegetables. One study found that soaking apples in a baking soda solution for 15 minutes effectively removed nearly all pesticide residues. However, it's important to note that this applies only to pesticides remaining on the surface, not those that penetrate deeper into the fruit or vegetable. For those who miss summer and its mosquitoes, let me remind you that baking soda can relieve itching caused by mosquito bites. The U.S. Centers for Disease Control and Prevention recommends applying a paste made of 1 tablespoon of baking soda mixed with water to the bite area. For the best results, Leave the paste on the skin for about 10 minutes. And that's the last piece of information for today's video. If you enjoyed this video, please give it a thumbs up and subscribe to our channel so you don't miss future episodes. Let me know your thoughts in the comments below, and feel free to share this video with friends who might find it helpful. See you next time.